down and have a seat.
Teacher voice.
If we could, let's everyone have a seat. This feels like home to me. My name is Nelson Spencer. I'm the superintendent of McDowell County Schools, and I walked these halls a long time ago. We graduated from this school in 1981. I'd like to welcome everyone here this evening, and this is a great turnout. I've been to 4 or 5 of these already, and this is the most crowded that I've had any of these. So I am delighted to hear from all of you this evening that want to speak. By the end, I think most everyone will speak. They put no and maybe, but by the time we get through, everyone hears everyone else, and see, it's not that bad to come to the mic and speak. So they decide to speak. What we're here for this evening is to hear your ideas and suggestions on how to fix PEIA. That was a big thing during the teacher strike, that there were signs everywhere that said fix it. And then as a superintendent, I asked my own staff, what do you mean by fix it? And it varied greatly. There were a lot of issues that came up that I learned about, and then in these last 4 or 5 meetings, there's even more issues that I've come to understand. One of the fixes most definitely is going to have to be the funding of PEIA, some type of permanent funding. I've heard that over and over. I would like for my colleagues here, they're on the task force with me, I would like for them to introduce themselves and tell you who they are and what they do.
Thank you. I'm Dr. Sherry Young. I'm a family physician by trade, and I'm a Mullins rebel. And when that was a high school, I guess I'm dating myself, back before we joined forces and became the Warriors, the Miami East. But very happy to be here. Again, I'm a family physician by trade. I got my primary education in Mullins, and I'm here to pay it forward. Most of all tonight, I am here to listen to your needs and to relay that back to Charleston. So thank you.
Thank you. I'm Delegate Mick Bates. I represent the 30th District, which is essentially Beckley and Raleigh County. I'm one of the 3 House members that have been assigned to the task force, the sole Democratic member that's been assigned to this group, and I'm very interested in hearing all your comments and suggestions as to the things that we need to be doing to, as Nelson said, to fix both the problems with access to care, with affordability, as well as the funding of those programs. So thank you for coming tonight.
And I'm Dale Lee. I'm the president of the West Virginia Education Association and the Bailey'sville Rough Rider. So it's, yeah, that's right. You can do it. It is hard to imagine that 3 of the 29 people on the task force are Wyoming County people. So that's great representation. But like the other 3, I really came here to listen to you to what your fix is. We've heard, this is my 7th one so far, and after this I have 3 more to go. But I've heard a lot of the same things, but in each location I go to, I hear something unique, something that's special to that specific area that I'm in. And I'm sure that I'll hear the same thing here. But I also want to tell you that we really need to thank Nelson and Sarita Beckett for really pushing to have more of these across the state and to have them in areas where people didn't have to drive very far. Nelson insisted this be at Pineville. I was trying to push for it to be at Bailey'sville, but I lost. But it is good that everyone's here and come out, and this is one of the biggest crowds that I've had at the 7th one that we've attended. So without further ado, I'll turn it over to Nelson to call the speakers.
The way we'll work this evening, we have a list that signed in that wish to speak, and when you do speak, we would ask that you come to the microphone. I will remind you that these are recorded. They're actually going to be played back to the PEIA members. You can go on the website and watch all of these if you would like. So we need you to speak clearly and civilly. I don't think we need to say that, but I grew up in Pineville, and sometimes we're not civil. Or used to not be, I should say.
The Bailey'sville people are. It's the Pineville.
And I've got a lot of McDowell County blood in me now. We'll just leave that at that. I guess you could tell Mick was the only one that wasn't from just by the
Here's my
accent.
crowd, yeah.
I thought he was from Herndon.
Bud. The first speaker we'll hear is Mary Weichel.
While Mary's coming to the mic, one other thing. We can't answer specific questions about the plan. If you have specific questions about coverage or things like that, there's a really good chance that we can't answer those. But what we do is to take down notes and then we can get answers for you in specific. So if there's any one specific thing, it may be better to come and ask us individually, and then we can get the answers for you.
Hi, I'm Mary Weichel. I'm a school bus driver, proud school bus driver of 32 years. I don't know, I've thought a lot about this. I've watched a lot of the online videos. I went to Charleston. I sat in the House Gallery. I sat in the Senate Gallery. I don't know what the solutions are. Some of the things that I've taken notes on has been, you know, I have Graves' disease. It is nothing compared to the stories that I've heard of cancer and patients trying to get out of state care and stuff. So I won't even go there with that. I will also not blame the fact that I have had radioactive iodine to burn out my thyroid as my weight problem. My weight problem is my own fault. I realize that. I also understand that healthcare is something that our premiums are based on, you know, the amount of usage, you know, across the state or whatever, and the abuse of the insurance as well. So that, I know, affects our premiums and such. What I don't understand is my blood work checks out good, my cholesterol and so on and so forth, but I'm penalized for the circumference of my waist. That I find an issue. When Go365 first came out, because I have lost a little weight and I have maintained keeping it off through an app. So when Go365 came out, I jumped on board. And then I started listening to the people that I was talking to about it, and they either didn't really have great reception or they didn't make enough to afford the phone and the services. Their Wi-Fi was terrible in the place where they lived. So it wasn't something that was good for everyone, even though I thought it was a good idea at first. The trinkets, as they have been named, what if we could turn those into premium points or copay points or prescription points, where the points that I earn, I could turn in for money off of my prescription or my copay or my premium, plain and simple. You know, I've thought about solutions. You know, I try to look at this open-mindedly. I was raised in a business, so I try to look at it from all sides. The gas severance tax, it looks great on paper. I don't know what the House and Senate is bound to or whatever. I don't know what can be done or what can't be done. Let's just say that. But it looks good. And when you go to Raleigh County and you see all this pipeline that they're going to put this gas through, and if the national average is 7.5%, we're only getting 5%. Why wouldn't we go to 7.5? Because I drive by Speedway every day, and Speedway's gas is always 10 cents more on a gallon, but they're filled up. So they're going to still buy our gas regardless of that 2% increase on the severance tax, in my opinion. And I don't know what it means to them or what it would mean to us, but it's worth looking into. Also, medical marijuana. My dad died at 97. Lived a good life. He died of cancer. He got at 89. And medical marijuana, I could see he would benefit from it because he would have ate better, he would have slept better, and he would have been happier, you know, at times. So I am not opposed to that. And also, there's a lot of reclaimed mine sites that, and I don't know anything about the cultivation of marijuana. I'm drug tested for my job, so I don't know anything about it. But I was caught out back a few times. Deidre and I went to school together, so. She was one who wasn't, but I was one who was. That's the group I fit in with. But anyway. you know, to cultivate it and put that, I don't know, is there gonna be a severance tax on that as well? The reclaimed mine sites, will it grow in that? You know, I don't know what the issue or solution is, but it's just something that is in my head, and I'm throwing it out here to you. Another thing that I learned while the impending work stoppage was going on, that small business owners, the mom and pop stores, they pay 52% taxes on their video lottery machines. I'm not going to put $20 in a video lottery machine, but why should they pay 52% when the 4 major casinos in West Virginia pay 17%, and 10% of that they can use for advertising? So where is that fair to the struggling mom and pop stores who are getting slammed with 52% taxes? You know, there's some funding there somewhere. And lastly, couldn't Jim pay his taxes? I mean, wouldn't that help us out?
All right, the new rule is no one from Bailey'sville can speak.
Especially about Miss Klein.
I'm not worried about Miss
Just
Klein.
saying, I'm scanner.
I'm not worried about Miss Klein. Nobody from Bailey'sville.
Oh, okay, you. Next, we have Brenda Smith.
Don't terminate me.
It's already in the mail.
I do actually know the record is going to get this. There. Thanks to my feet.
Don't laugh. So, the major concern that I have is the cost of the health care to actually have testing done. Once you've met your deductible, I know I have a friend who has to have an MRI done every year. Last year, she paid $350 her part. This year, it was $750 up front and another $750 within 30 days. So it's just an exuberant amount. Nothing has changed with the cost of the test. It's just that part that we have to pay. Also, medicines that are life-saving medicines. We've had kids that come through school. I'm a high school counselor. So we have kids that come through school. I work very closely with the school nurse. So things that were covered before, and right now I'm thinking inhalers, is that right? Okay. So inhalers that were covered before are no longer covered. And I'm sure there are other things, but those are just 2 of the major things that really bother me, to know that we're still paying these high premiums and that our services really haven't changed. The cost of our services really haven't changed, but what comes out of our pocket has changed tremendously. That's all.
Thank you. Next, we have Deanne Mullins.
My name is Dolores Mullins. I go by Deanne. I'm the PEIA Benefit Coordinator and Payroll Supervisor in McDowell County. So, Mr. Spencer and I have had several conversations about this. I'm lucky enough I have UMWA insurance, and I thank God every day for it. But my son has PEIA. He is employed with the correctional up and outside of White Sulphur Springs. He lives in Virginia, and it's difficult for him because Pocahontas County is probably one of the closest counties to him, but he can't, there's no hospital that I'm aware of that is a major hospital. I think they have a little small one, but he has 2 children, so they go to the doctor quite often, and he has to pay extra in it because his doctors are in Virginia. So that costs more with the deductibles and out of the pocket. And most of the employees in our county, their biggest concerns is, in McDowell County, yes, we have a hospital, But most people live in regions that are, it's closer for them to go to Kentucky or Virginia, and they want to see the contingent state counties come back in play. That's one of the things that has really hurt them, because they have to try to find another doctor. And unfortunately, because Bluefield, Virginia and Bluefield, West Virginia are so close, most doctors have moved out of West Virginia to Virginia because it's cheaper for malpractice insurance and other items. The funding source, which everybody knows it needs to be, the severance tax on gas, I think, is a good proposal. Myself personally, I think marijuana should be legalized and taxed, just like alcohol, other tobacco products. Of course, McDowell County has a lot of that as free range, I guess. So other people make money, and they don't pay taxes on it. And you know who they are, and they drive brand new vehicles, they have new houses, and they pay no income tax or any other kind of tax. So prescriptions, the co-pays, what's covered, that's another issue with them. And a lot of our employees were really upset when they were talking about the employee with the employee spouse discount, doing away with it. That was an upsetting part for them, because it does, and in all probability, it balances out what, if you have 2 employees in the county that's paying, it really doesn't cost that much more for PEIA, because if they're in separate plans, they're going to be paying separate, but they're not going to be paying probably as much in premium, especially if one of them is a smoker. So, that is about it. Thank you for listening. Hope it's changed. We'll talk more.
Thank you. I have Joe Browning as a maybe.
Well, I didn't come here to talk, but I do have a little bit of a story. I've been teaching since 1975. I'm still teaching off and on, not full-time. But PEIA is the main reason I'm still teaching. My husband has CLL cancer. His medications are over $11,000 a month. So PEIA has been my friend, my family's friend. I mean, we wouldn't be here. When I look at premiums, I think, okay, I'll pay more. I don't mind, you know, but I look at other people that are just now starting teaching, and they can't really afford what people that really have a lot more years and a lot more experience and a lot more education, they can't afford that either. So we really need what we can get, because a lot of times back in the late 1980s and the 1990s, and other states were getting, and you've heard this, other states were getting raises and things, and they said, okay, we'll take care of you. And when the insurance started, it was free for employees. Employees were free, and then they said, oh, okay, well, we've got to pay a little bit for your family or your spouse. And we said, okay, you know, that's only fair. And then they said, well, okay, now you have to pay for yourself. So it's keeping on and on and on, and I completely understand, because the prices are exorbitant. And if we had the power and we had the wherewithal to lower the cost of some of these medications, it would really be wonderful. I know I take an arthritis medicine that when the last 2 years that it went, before it went generic, the price quadrupled. And they said, okay, it'll go back down in about 3 years because they have to go generic, so they're going to make it as high as they possibly can. A couple other things that really upset me, when they started the Go 365, and you had to, you know, we didn't know, they send us the stuff in the mail and say, sign up for this, you have to, so we did. Do you know the only location that we could go to that was within like 50 or 100 miles of Pineville for our exercise or physiology or whatever was an acupuncture place in Beckley? That was the only thing that was listed. We couldn't go to Body Works. We couldn't go to the Princeton physical thing. We couldn't do any of that. It was only an acupuncture place in Beckley, which is crazy. You know, that's completely crazy. The other thing, when they start talking about basing your premiums on your family income, nobody does that. Base it on age, base it on what kind of illness you have, what you're using or whatever. But the way that read and the way I understood it, if I had kids and I kept my kids on this until they're 26, then when they're in college, if they had summer jobs and they had a income tax statement at the end of the year, their income went on that. If they got out of college and they're 22 and they got a good job and stuff, you got to count their income on your premium. It doesn't make any sense, you know. How are we helping out our students from the time they're in college until they're 26 if we're going to count their income and make our premiums go way up? You know, if they're healthy at that time, they may as well do without insurance, you know, as far as the family goes. I don't see, I mean, there's a lot of things we could do to help pay for our premiums. We did away with the food tax. You know, it wasn't that much. It wasn't that much. We need to tax the gas, but like they say, gas is not going to be there forever, but we can make hay while the sun shines, you know, and then when it's not there, then we'll try for something else. That's all I gotta say. Thank you.
Thank you. Katie Prussia.
I'm coming with a solution. It's a very basic one. In talking to one of my House of Delegates representatives, he brought up the 1% soda tax. And the 1% soda tax had originally been allocated to Ruby Memorial Hospital's building in the 1950s. Given that that's associated with WVU, and we all know that WVU doesn't need that money, take the funding, that 1% soda tax that's already enacted, people are already paying for it, doesn't raise any taxes, which is a large issue we were having, reallocate it to PEIA. There's a funding source that's sustainable. That's it.
Thank you. Dwight Stafford.
Hey, Baptist preacher, promise not going to be long, okay? I'm Dwight Stafford, and I've taught most of my life. I've been a public employee, either in Logan County, Wyoming County. I worked for Logan Mental Health, been on PEIA most of my life. Paid premiums for years, never used it. Well, that changed recently, well, in the last 5-10 years, you know, as age catches up with you. Now I'm a diabetic. Last year I had a heart attack, and been teaching, like I said, love teaching school, but I'm going to have to quit. I'm going to have to, the way it looks right now, if things aren't fixed, planning on working 5 more years, just turned 60, I can't get my medication approved. Recently I had like I said, I had a heart attack, went to come out, done real well with the surgery. Was not recovering as quickly as the doctor thought I should. He done an echocardiogram. My ejection fraction was 30, and they wanted it to be 50. So he took me off one medication and put me on a medication called Entresto. Within a week, I was back to my old self. Only problem is I can't get it approved. Right now, every time I go to my doctor, he gives me a card to go out and get some more until something happens. With that saying, like I said, if I can't get it approved, I'm going to have to apply for my disability and no longer teach, which I love to teach, and that's really going to hurt. But, you know, I also like living, so, to get the medicine, I'll have to do that. Teach West Virginia history. So I can't get up in front of a crowd of people and not give a history lesson. Wyoming County had a governor. Love him or hate him, Governor William Marlin come from Wyoming County. Had some issues. Everybody knows Governor Marlin had issues. But one thing Governor Marlin had was good ideas. In fact, many people call him a governor who was ahead of his time. He was the first governor who came up with the idea of putting a severance tax on coal. And this was back in the 1960s. We'd already been mining coal almost 100 years when Governor Marlin said, let's put a severance tax on coal. Coal had been here a long time. Coal is still here. And we're getting a little severance tax. They ran him out of town because he came up with that idea. Folks, natural gas has been here hundreds of thousands of years. It's going to be here. They say, well, if we put a tax on it, they're not going to take it. They're going to come get it. It'll be here. And that's my 2 cents. Thank you.
Tony Painter.
Hello, everybody, and thanks for coming. The lady done got my best idea for the funding source. The 1% soda tax has funded Ruby Memorial, as the hospital been built for, 60 years. We transfer that over and fund PEIA with it, and it should be pretty sustainable. As far as the gas severance tax goes, I would like to caution us, we probably need to limit that to horizontals, because the conventionals are, in this area, are mostly real low flowing, and it's not, companies are selling out left and right, and it's not real profitable down here. But in the northern part of the state, where the horizontals are, it's massively profitable. And the bad thing about the whole PEIA thing is as we go forward, unless we get some help on the federal level, the way costs are rising, we can fund it all we want, but we're going to be right back here in a couple of years the way the costs are rising. So it's not an easy problem to solve, but I think we get enough people on it, we can solve it. And also, I like the idea of taking the Go 365, ditching all the penalties, getting rid of anything that resembles a penalty in PEIA and making it incentives. Because you're never going to get anywhere penalizing people. You give them incentives, you might get some progress there. But that is about all I've got to say, and I mostly came here to listen, and I've got some good ideas here already, so thank you all.
Jordan Manning.
I'm here. I'm just getting on the stuff here.
Hi, I'm Jordan Manning. I teach at Berlin McKinney Elementary. I'm a second-year teacher there. And I'm really just here to ask if there's any ideas on helping the retired people. I know I'm nowhere near retirement, but my mom just retired. And as you get older, you have more health problems, and she has to pay more every single year that she's retired. She worked 38 years for the state. She was a great teacher, in my opinion. I mean, I'm her daughter, I'm supposed to say that, but she really was. She was an awesome teacher. She was my teacher, too. And I just think it's so unfair to her to work all those years and give all that time and all that dedication to now having to pay almost double, if not triple, what she paid when she was a teacher. And so I'm just looking for any suggestions or any part of your plan to help those that have retired. Because eventually I would like to retire here. I love West Virginia. I love being able to teach here and work here, but if it keeps going how it is, I'm not going to be able to stay here. So I want to be able to stay here with my mom, but also see it improve for her before I retire. I mean, because that'll be 30 more years probably or more. But I just want some suggestions or help for those that are retired that are still on this insurance, because my dad passed away. That's our only insurance that we have. So I've been on PEIA my whole life. It was good when I was born, but now I'm older and have my own policy. So it's not as great as it was 25 years ago. So just anything that can help those that are retired are definitely what we need. Thank you.
That is all we have that have signed up to speak this evening. Before we go any further, I would like to recognize the people that are from the delegation, the House delegates here. Mr. Bates has already introduced himself. Mr. Ed Evans would stand up. He represents McDowell County and Mercer County. As well as Mr. Painter, he just spoke a moment ago. I think you all know him here in Alma. We appreciate you fellas being here, because actually you're the ones that are going to hear our suggestions. You're going to have to take it back to fight what we think is the right fix for PEIA. Are there any others that want to speak? We didn't have a whole lot to speak, but here comes the McDowell County boy that wants to speak.
That's right. Rough Rider.
Yeah.
I was a Rough Rider before I was a McDowell County boy, though.
He can't speak.
Sorry. I'm going to stumble through real quick here.
Speak, but no personal stories.
No personal stories? Well, let me tell you, back in 1999, no, we'll let it go with that. This PEIA situation, it is, as far as I understand it, PEIA stands for Public Employees Insurance Agency. Am I incorrect in that? Okay, if I go and buy an insurance policy at State Farm today, will they not base it on the risk that I do, as far as me driving a vehicle or my home or whatever? Is that not the way insurance actually works? So when we group all these people together, and when we just bulk them together and say, well, this is what a premium is. And I, firsthand, 2 days ago, my wife and I took my son, who has a wart on his toe, to a dermatologist in Bluefield, West Virginia. We didn't leave nothing. $80 copay to put essentially Compound W on his little wart and wrap it with a Band-Aid for $80. Now, I'm not a genius, but somebody's making some money somewhere. I mean, I'm a Batesville grad. I went to college and did all that. But $80 for a $2 tube of Compound W in which you put 2 drops on, that's absurd. So one thing that we need to do as a legislature, and Mick's here, and Ed's here, and Tony's here, but one thing we need to do as a state is start regulating the amount of money we pay. And PEIA is governed under this state. We control it. So we say, this is what we're going to pay. You take it or don't take our insurance. Don't take it or say you don't want our money. One or the other. And that's the things we need to do. This state needs to quit laying down and rolling over and allowing people to take advantage of us. And the southern part of this state has been abused and abused, just like this gentleman said back here about the only governor that's come from the southern part of the state other than Earl Ray in Logan, from Wyoming County, about the coal severance tax. They ran him out of town, and he was a taxi cab driver in Charleston afterwards. Now, well, Chicago, you're right, Dale, you're right, I'm sorry. He started in Charleston, and then he went on to Chicago. You're right. You're right.
I'm sorry.
But well, you and I both know a little bit of our southern history because we come from Batesville, and we're proud of our southern heritage. Down in this county, not just Batesville, Mullins, Pineville, McDowell County and Welch, where my wife's from, we're all proud. Norfolk is the state, they have a cardboard sign up, and it's it's basketball capital USA. But all we can afford is a cardboard sign that says that. And that's absurd. But yet we can spend money year after year, every time we elect a new governor, to go out and put new signs up that says Governor Jim Justice, Governor Earl Ray Tomlin, Governor whoever, Joe Manchin, whoever the case may be. And those signs aren't cheap. Those are metallic signs with reflective paint. Every single one of those are $50 plus. But yet we can't afford to take care of our own people. down in the coal fields. This state was built on our backs, on every one of our backs. And we got a coal severance tax, and I'm telling you right now, every person in this audience right now, you may not know it, but your coal severance tax goes to all 55 counties. All 55 counties, whether they produce coal or not. Every dollar of it's divided. Guess where your gas severance tax goes to? It goes based on production. And just like Mr. Painter said, well, wait a minute. We don't need to go that far. We don't need, because we'll run them out of business. No, that gas is in the ground. And we built this county, McDowell County, Mingo, and Logan built this state. It is time they paid us back.
Are there any others?
I will. Which I don't need a speaker. I got a good carrying voice.
Yeah, but we're recording it, and so it's easy.
I wasn't going to speak. I wasn't prepared to speak. I'm Carolyn Morgan. I teach at Berlin McKinney Elementary in Oceana. I worked 10 years in McDowell County. Loved McDowell County. My thing is that I'm just going to tell a little story. My husband had an injury to his back. We're not sure what happened, but something happened. We have been months getting approval for an MRI, to follow up with an orthopedic or spinal doctor. It's been a battle. My husband is 47 years old. I pay PEIA, I paid it for a long time. Didn't really need it. We don't have, any major issues. My nephew is 21 years old. He has a Medicaid card, playing football with friends outside last week. Got an injury to his back. He's already had his MRI. He had his appointment in Morgantown yesterday. They're already setting up to do the injections. We're still waiting. I have paid for years. And not to knock Medicaid, not to knock my nephew. Great respect for Medicaid, love my nephew. But why can he, at 21 years old, who has not worked and gave his money, gave his time to a career that I love, get in there, get it done, and my husband is still waiting, working every day in pain. Why is it okay? That's my question. And I'm like, and I don't usually speak at these because I do get very emotional, because, it's my family, I hold them dear. It's my job, I hold it dear, I love what I do, and I wouldn't want to do anything else, and I don't want to do it in another state. Could very easily have done it in another state from the beginning of my career. I don't want to. I love West Virginia. But I want y'all to look at that. Why is it that our PEIA, nobody wants it? Not only are we paying out the yin-yang for it, but nobody wants to accept it. Nobody wants to okay that MRI. And why is that? Thank you.
Excuse me, if you would make sure that before you leave tonight, I get your name and number.
Absolutely.
Yeah, and we'll make sure that somebody looks at that situation and see what the hold-up is for you.
I'm not exaggerating. We've been months.
Okay, we'll get that taken care of.
I bet he doesn't pay as much for his medicine either.
We both had a cardiologist appointment, and we paid $40 each, and we both have an echo just because, it's age. We're in our 40s. It happens. But we both have an echo tomorrow, and I'm terrified of how much I'm going to have to pay for that. And my cardiologist suggested a cholesterol medicine because my cholesterol hasn't changed, but it's 251. It's family history. We grew up on fried food and all that good southern stuff. We love it. But anyway, PEI won't approve it. It's only 251 right now, and they want to stop it before it goes anywhere. They tried 2 or 3 different times, and PEI has not approved either one. So that's a cholesterol medicine. It's not really a life-altering medicine, but still, it's an everyday issue that you have. Just like someone said about the inhalers. It's every day. People get tired of fighting over it.
Thank you. Anyone else? Mr. Evans, you come on down, sir.
I'm Ed Evans. I'm in the member of the West Virginia House of Delegates. I represent McDowell and a little bit of Mercer County. I've basically came to listen today because, trust me, I have all the issues that you have. I have PEIA. I've been fighting with LabCorp. Oh my God. You're shaking your heads. Okay. I hate LabCorp because they hate my insurance. And they tell me, well, you got to have, this test done here. Can't do it anywhere else. And I said, well, Welch Community Hospital does a great job. And I said, well, we like the people that draw blood in this one particular doctor office I go to. They want their phlebotomist to draw it and not the one over there at Welch. And I said, that's really cool. Just so happens my wife taught them both in the Wyoming County Botech Center how to draw blood. And it bothers me that I've been fighting a bill. It's about $500. They'll probably be, before I pay it, they'll probably be taking it out of my paycheck. But they haven't paid any of it. It's just, okay, I'll pay my share, but you pay your share too. We've heard so many great things here tonight, you guys, and I have to applaud you that you have such great ideas. And we all have the same issues. And we've heard about the gas, and I want to tell you one little thing about the gas. There's two kinds of that stuff. There's the wet gas and the dry gas. Dry gas is what you burn in your furnace to keep you warm. The wet gas is what we hope to sell and will be selling to everybody. And it does come out of the north. And one of the issues is that we fight down here, our southern delegation, is numbers. We don't have enough delegates and senators down here to fight the numbers that they have. Let's say just in one county I can think of in the Panhandle has more delegates than we have all of southern West Virginia seated in this room right now. So that's where the gas comes from. So who are they going to listen to? They're going to start, going with those guys. So we have those issues, trust me. I'd also like to come with an idea for you guys. And, we have a great state hospital just right across the county line here. Where's the incentive to keep people working in that hospital? If everybody in this room could go over there to the clinics and the ER at, let's say, half the price because it's a state hospital and PEIA is a state insurance. Would you do that if you could do it for half? So, PEIA needs to look at something like that. Let's keep West Virginians working. Let's give PEIA people that, as West Virginia have it, a break. And let's use a state hospital. Now, I know we don't have a lot of state acute care, but, we continue to lose things in the state hospitals because of PEIA. I think about OBGYN services over there in McDowell. We lost that because, PEIA. Now, there's some people making a lot of money delivering babies in Wyoming, or not Wyoming County, but in Mercer County, and we could be doing that, keeping people employed right here in these two counties. And making a difference to our everyday persons that depend on PEIA. So let's give our state hospitals that will take our PEIA patients a break. And if we have state, I don't know, what other providers like that do we have? I don't know. But let's give those guys, a break. Thank you very much, everybody, and thank you for coming out tonight. I'm thrilled to see these numbers.
My name's Jerry Stepper. My wife teaches at Westside High School. She formerly taught at Bailey'sville. And according to Dale, she graduated from Bailey'sville also. I have one suggestion. I run a small business here in the county. We have a funeral home, so I talk to a lot of people. I have heard from several people of the families I have taken care of that did PEIA was their insurance choice. And I've heard several people tell me that doctors had called prescriptions in for them, and a pharmacist or pharmacy would tell them, oh, no, you had that prescription a week ago, a month ago. It can't be given again. They did not have that prescription. I think that one way that you could help to reduce your costs of medicine for the people is maybe every time that you get a prescription, they should get a little letter. That way they can do their little part and just check off or go online or somewhere and say, oh yes, I did get this prescription. So that somewhere, and I do funerals in Mercer County, I do funerals in Raleigh, Wyoming, McDowell, Mingo, Logan. So I'm hearing this from this whole southern region, you know, just to check off. I'm sure they would be more than willing, if they could keep their costs down for their drugs, to say, yeah, I did get that. And then they come back, oh, I didn't get that. Then somebody with PEIA should be checking into, hey, who did they give this medicine to? But they put it on your insurance because you had insurance. And how many times does that possibly happen, even in doctor's offices? You got someone that thinks that, oh, I know them, they're healthy. Somebody comes in, oh, we'll just do it here. That way they're getting the pay. So I think maybe that might be something, and like I say, I'm sure everyone here would be more than willing to just check a little thing to say, yeah, I did get it. Thank you.
Thank you. Anyone else?
I just want to add a side note. I'm hearing
a lot about care for physical ailments, but I also think it's really important that PEIA continues to cover mental health issues. I know that it currently does to a point. You have to meet your deductible, and then you have co-pays and such. However, I also know of people who have gone to different places for mental health care, and even though our insurance year, I'm not sure the phrase I'm looking for exactly, is from July, you know, all the way through the calendar year, in January their co-pays increased for no apparent reason whatsoever. So that's definitely something that also needs to be looked into, and just to be sure that PEIA does continue to cover mental health care costs.
I didn't come to speak, but I do have a concern, and after I listened to the little Manning girl talk about her mother, I am one of those retired people. I worked 40 years in the school system, and I had PEI and paid it for 40 years, and I hardly ever used it. I was healthy, but now I have Medicare. And I thought when I got 65 and got my Medicare, I'd have a Medicare card that paid first, and PEI would pay second, but it doesn't work that way. My Medicare now is Humana Medicare, and I find I'm paying more money for my doctor than I did when I was on PEI. I'll give you an example. I went to the dermatologist. Usually I pay my $40 copay, which I thought my PEI would pay my copays now because Medicare's gonna pay my doctor bill. That's what most of them do. That's not what it does. So I go in there, and I had this little place up here, he's gonna freeze it off. So he did it, no big deal. I get my Humana papers, I owe that dermatologist $100. So I called him, and I said, why do I have to pay this $100 to Humana? And she said, you had surgery. I said, surgery? There was no cutting, no stitching, no nothing. It was just to burn off a place. She said, well, that's your part you have to pay. And I said, well, that's not fair. She said, don't talk to me. I'm just Humana. PEI pays us to manage your money, and they tell us what we can pay. And they said you had to pay that $60 extra. So instead of 40, I paid 100. And the very next doctor's appointment, I paid another 100. I went to the ear, nose, and throat specialist, had a sinus infection, scoped my nose, got my Humana bill, I owe them $100. Now, I didn't pay that when I had PEIA. That's not right. So if I'm not understanding it, I think it would be nice if PEIA or Humana had some kind of an in-service for us retired people to explain to us exactly what to expect. I don't know what to expect. Thank you.
I've been here a minute ago, but there was something that came up and I was asked to bring this up. There are people that are on PEIA that their families have a drug that they take, or a member of their family, they take it every month. And they don't have any other insurance, so they get a letter every year that says, do you have another insurance? And you have to fill that out. It's to make sure that you keep your maintenance drugs. Well, there's some people that they don't find out that they have to pay or have to complete that form until they take the prescription to be filled. They don't know, and then the pharmacy tells them, no, we can't fill this out because it's refusing to pay. So they either go online or call and find out, well, you got to complete this form. So you complete the form, and by that time, you're out of the medicine, and you've gone 2 or 3 days probably before it can be approved. And if you're on diabetes medication or some kind of cancer medication or cholesterol or whatever, you've gone 2 or 3 days or more without that drug, when every year it's exactly the same thing. So if they could just send you out a notice a month ahead of time and say, your year's coming up, can you complete this before your next refill, that it would be very, very helpful for people, because this has happened to 2 or 3 people that I know.
Come on down, but with regards to that, one of the things that we've already talked to PEIA about is each year when you complete your form that says, are there any changes in your policy or any changes in what you're doing, it should be that when you complete that goes on to the other agencies that sees that you don't have any additional insurance or anything else. And we're already working on that issue, so we're working to get that cleared up.
Hi, I'm Kathy Eastep. I normally don't speak in public, but I'm from McDowell County. I receive PEIA. My children both are teachers, and they have PEIA. My grandchildren have PEIA. We live on the border of Buchanan County, okay? If we go, and all of our doctors have always been over there, simply because we can be to that hospital in 30 minutes, okay? My daughter-in-law is pregnant. She has PEIA. She travels 2 hours to Princeton for her OB appointments. There is a hospital that delivers that's within an hour of our home. She can't go there. They say, oh yeah, you can go, but who can afford it, okay? If you go over, we do see our doctors over there. My granddaughter sees a pediatrician. It's $20, her copay. But if she has lab work there, or if she goes in the hospital, you can't afford it. And the way it's set up, if you have to have a procedure, such as a colonoscopy or something, they have a set amount. They pay that, and you pay the remainder. And those amounts are very low, okay? If you have a grandbaby, 2.5 years old, with a temperature of 104, who wants to travel when you could be to a hospital a half hour? I mean, that needs to be looked at. It's really not fair, in my opinion, to do it that way. There's children and adults with Medicaid. They can go over there and pay nothing. I mean, how fair is that? Also, the retirees,
Humana. I work with a lady who retired. Of course, they turned in their sick and annual days to pay for their insurance. This Humana is so expensive, and I'm shaking, I'm sorry. It's so expensive. She dropped PEIA, took up a private insurance through AARP, and had better coverage. She has 100% coverage through that. I mean, you work all your life thinking you're going to have that extra 20% to cover what Medicare doesn't cover, and it doesn't happen. I mean, I don't want to complain. I mean, you know, we're thankful for what we have, but you need to look at what we're doing to our employees. We want to keep our employees, but they're going to leave. Thank you so much.
I do have one issue I promised this lady I would ask about, and I totally forgot, so bear with me. I don't take any pills. I'm fortunate that I don't have to take any medications. But this lady said that she has blood pressure issues, and she takes a blood pressure pill, and her doctor wanted to try her on a particular blood pressure pill. PEIA made her buy a 3-month supply of it. Okay, does that sound right? Okay, so she had to pay 3 months supply out of her pocket, and then she had the blood pressure medicine didn't work. She goes back to the doctor the following month, tries her on another one, and she had to buy again a 3-month supply. Does this sound? Am I doing this right? Okay, because I don't take any medicines, but and I don't know if there are other medicines like that have to. Yeah.
You have to pay for it when he changes it
right.
Until they establish that it works. And then once they establish that it works, then the pharmacist can contact your insurance, PEIA, and get them to approve it once that it's established that that's what you're going to do.
Thank you. Thank you very much. Appreciate that. So again, I needed their help because I said I don't take any medicines, but if I've been to pay for a 3-month supply for something that doesn't help me at all, that's throwing money in the ditch. Okay. So let's fix that. Okay. Thank you, guys.
Yeah. We've checked. That's come up before at other places, and they will pay. The microphone's off. They will pay for 2 30-day. It's called a trial prescription.
They say they'll pay for it.
And what I'm told, I understand. I didn't make the pizza. I'm just delivering. They say we'll pay for it. The problem that we see is a problem with the way that the doctor may be issuing the prescription, and so that's something that we got to work out. And we already know that problem exists, and that is one of the concerns that we are looking at to. Now it works. To make sure that you are trial medications when you have to change medications, that's a 30-day supply, not a 90-day supply, because you're wasting the medication if you don't.
I can tell you firsthand that they require me with my blood pressure medicine to have a 90-day. Firsthand. They won't feel it, or else I have to pay cash for it. And on that same note, well, I've got 2 things now because I've had some people up here ask me to say something. And again, I didn't introduce myself. My name's Andy Vance, by the way. I'm sorry. Earlier, you get something in your head and you just really ready to get it out there, and so I didn't introduce myself. But I took Benecor HCT for my blood pressure. I'm a pretty healthy looking guy, but I had a car accident that caused me to end up having to go and go to cardiologists and all that good stuff. And my doctors, for the longest time, 140/90 is not a on medication is not a good blood pressure, right? Anybody that has anything that knows anything about medical knows that that's not a good blood pressure. But guess what? Mine on a daily basis, on medication, 100 milligrams, 140/90. My cardiologist says, well, thank God you ain't had a stroke yet. So that's essentially where I'm at. But PEIA didn't want to pay for Benecor HCT Plus. They said, well, you know, as long as you want to pay for it, which was like $87 a month, I believe, for, 30 pills, you can get it. But until then, until there's a generic for it, good luck. Well, there's a generic for it now, and I have it in the vehicle, and I can't. Losartan is the name of it. It took me a second to think of it. Losartan 100 milligrams is what I take now. And thank God that it's not the $86 that I was paying for Benecor, but it's not nearly as effective. My dad, the other day, I wasn't feeling good, and he said, well, why don't you take your blood pressure? I took it, and I had taken my medication like an hour before that, and it was like 153 over 103, something like that. My mother's a nurse, thank God. And she's like, well, you just need to hang tight. You just need to sit here with us for a little bit, which they're glad because I don't never get to visit them. So, of course, she's going to tell me to sit there. She's like, yeah, sit here. You want something to eat? You want something to drink? Hang out with us for a little bit. But anyway, that's beside the point. I had somebody up here give me this. It said that one of the agreements for the teacher strike were not, it wasn't actually a teacher strike. A lot of people are misconceived about that. It wasn't a teacher strike at all. I was there all 9 days. It wasn't a teacher strike. My wife's a teacher. It wasn't a teacher strike at all. Has nothing to do with that. What I had to do was every single public employee in this state. I was a deputy sheriff for 10 years. PEIA will affect me to the day I die. My wife was a deputy sheriff prior to becoming a teacher, 10 years plus. Now she's got a master's degree and teaches AP history at Mount View. PEIA will affect my family and my children until the day I die. So I absolutely want to get this fixed. Not just for us and not for my children, but for all of you. We absolutely have to have it fixed because we can keep throwing, we can kick that can down the road. Just kick it down the road. And as long as we don't look at it tomorrow, we're all right. But we got to have it fixed today. And so anyway, somebody back here gave me this message and wanted me to come down and read about it. And said that the strike ended because the government, the Senate, and the legislature agreed that there would be a PEI freeze on premiums for 16 months. While the task force, which is you guys are part of it, Nelson, I like you, we've been friends a long time, Mick, Dale. So it says that while the task force investigated solutions, and then today, this person says today, they were notified that on June 15th, their check would be charging according to our income on our premiums. That's not 16 months, right? June 15th isn't 16 months. So I don't know, you guys may not, or you guys and young lady may not know anything about that, but that's something we definitely need to look at, right? And I know, I mean, like I said, you're not on the PEI, you're on the task force.
I'm going to answer this one.
That's it. Go ahead. Because these folks want to know, back here in the back.
Yeah, I understand.
Some of our Bozeville people, Dale.
I understand. And I'm already checking into this. I got a text message earlier in the week, and you have to kind of forgive me if I don't get an immediate answer tomorrow. My daughter's getting married Saturday, and I'm a little tied up with her. But what happens is because of the tiers that you have for the premiums. If you're right on the edge of the tier, and you will be bumped up with next year's salary increase if you will go over to the next tier, and it won't affect a tremendous amount of people, but it will affect some. Your premium is based on that tier. Now, our contention and what I'm going to try to fight is that with the freeze, that tier should stay, I mean, it should be adjusted until we get through this task force. I don't know that we'll be able to accomplish that, but that's the way we're going to try to approach it, is that because it said that your premiums wouldn't go up, if you're real close to that next tier, there's a great possibility that it would go up, but we're going to try to fight that and see what we can do to keep that cost there.
So are you saying our next year increment plus 5% raise is about to fix?
If you're in that tier is what he's saying.
It could. It could.
So you didn't get a raise, essentially. Congratulations, you didn't get a raise.
Yes, you got a raise. Let me clear up a couple things here. Yes, you got a raise, and yes, it was a teacher and service personnel who were out for the 9 days. Although it affects all public employees, it was the teachers and service personnel who were out for the 9 days. But again, give me a little time to work on that. Don't shoot me yet, because that is one of the things that you don't think of when you're in there trying to settle everything and get it done. But you know, there is a small percentage of people that will bump into the next tier, and we just need to make sure that we can do something for them.
One suggestion that I have is let's go back to about a 6-tier system then.
Well, you can't while the freeze is on.
Right.
That may be one of the solutions that we have.
Right, that's part of what we're doing.
We bring forth for the task force is that we expand the number of tiers so that it's.
Well, I think that would be more beneficial for our lower income people, our DOH and some different folks that's making a little less.
It shouldn't be based on income though.
Well, it's going to be based on income to the end of the time. I mean, that's just the way it's going to be.
Both ways.
And I agree, just like I said earlier, insurance is actually based on risk, and PEIA is not based on risk whatsoever. Not based on, it's based completely on income and age. Have a good day, thank you.
But isn't the task force looking into, like, options for us as in a higher deductible, lower premiums, and vice versa?
We're going to be looking at everything. That's why we're here, to gather the information, to look at all the suggestions that our people have, and then we'll take these back to the task force, and the task force will look at every possibility that we can do. I mean,
I thought I heard that, sorry to interrupt, but I thought I saw that in one of the other news feeds, that was something that the task force was looking into, to give us options so that we could pay higher premiums, lower deductible, or higher deductible, but vice versa, you know, to suit your needs.
Yeah.
To suit my needs, you know?
Yeah.
So we have to give them a chance too, because there's, you know, their hands are tied. They're just here to get our information.
Go ahead.
My name is Donna White. I was a 40-year teacher in McDowell County, and I'm retired now. I'm kind of confused about this whole mess, but I'll explain it to you. I have money taken out of my Social Security check for Medicare. Then I have money taken out of my teacher retirement for PEIA. Okay, then I get this. When I first retired, I had July 1st, PEIA. Then November, I got Medicare and lost my deductibles for PEIA and had to do Medicare deductibles from November to December. Then in January, I got this Humana Medicare card, so I was supposed to use this. So then the deductibles started all over again in January, so I lost the deductibles for PEIA, deductibles for Medicare, started over with Humana. Okay, now I got a Humana card in my hand, and yesterday I got a Medicare card in the mail. So do I use PEIA? Do I use this Humana card? Do I use Medicare? What am I supposed to be using? That's my question. I'm getting confused by myself.
That one I can't answer, except that the new Medicare cards have a number, and I know that for actives, the fiscal year is July 1st till June 30th, and for retirees, the fiscal year is January 1st. It's a calendar year, January 1st. Yeah, with Medicare. So I can't answer that question for you now. We can find out and let you know.
Okay, thank you.
But send me an email so I don't forget, because tomorrow I'm doing rehearsals. So.
All of your case fill in at one time?
I just have a quick question. I read that Medicare.
Did you tell us?
Rosemary Farrar. I read in the newspaper that PEIA is going to charge 40%, 40-60 for people over 65. Did they pass that? Yeah. Okay. Thank you.
Michelle Perkins, also from McDowell County. I guess my question is, why do we have to have PEIA? I think I heard during the walkout that we were gonna look at maybe some other options, like Blue Cross Blue Shield or something else that might replace that. And when you are in that pool, then things change. When you're in somebody who's already got existing corporations or whatever under their belt, rather than being with a private insurer. So that would be a benefit to us. My other concern is with us being based on pay, what incentive is there for us to be bettering ourselves as teachers, becoming those highly qualified teachers, getting a master's degree, staying here, if every time we get a raise, every time we put in more hours, then we're penalized because now that money's just going towards our insurance. So again, this tier system and this based on pay is not working for us. And being that as teachers we're also under the state, it's kind of a give and take here. You know, do you want highly qualified teachers? Well, then quit penalizing us with taking out the money we're getting to better ourselves and making us pay more for insurance.
Anybody else? We still have plenty of time. Don't let us go early.
I would like to thank everyone for coming this evening. Especially like to thank Mr. Dillon. If you would stand up for hosting us here at your school. Ms. Klein, thank you for letting him do that. Anyone on the panel have anything they'd like to close with?
Folks, like I said earlier, we're gathering the information and we will take this back. But as she said, you have to give us a little time to come up with solutions. The key to this is whatever solutions the task force comes up with, you have to remember that it's the House and the Senate that will have to pass any revenue measures that we may recommend that comes up and things like that. That's why it's so important to stay active, to stay involved in the system, to stay involved in the proceedings of what's going on. Keep watch of the task force as we move into the planning stages, the program stage and the funding stages. And then we'll go back to the full task force to come up with total recommendations. This is just our subcommittee that's going around, but every member of the task force will look at the transcripts from these. Every public hearing is being transcribed and will be put into a spreadsheet so we can see the things that are common, the things that are unique to different areas. But just give us a chance to come up with some solutions. But the key to this is you all have to stay active and you have to stay aware of what's going on, particularly when it comes to passing revenue measures and things like that, and see where we go from there.
Hey Dale, thank you guys for serving on this board. It can be fun.
Be safe and have a good evening. I didn't recognize you.